Hello and welcome to my second CRPS Q&A video. This is a new series that I'm doing every single week on Friday. If you would like to have questions about CRPS answered in the next Q&A video, please comment down below, or you can join my Facebook group, which is called The Window Pain. That's PAIN on Facebook and submit questions on my weekly CRPS Q&A post. I'm really excited to be answering these questions for you guys, questions that maybe you didn't have time to ask your providers or that your providers just didn't know the answers to. As someone who was diagnosed with CRPS 10 years ago and then later went on to become a pain specialist and doctor of physical therapy, I am thrilled to be in a position now that I can provide this knowledge to you that stems from my 10 years of experience and education on pain. So let's get started. Let's jump right into it. And I'm going to attempt to do this video with no cuts at all, just going straight through. So if I have a lot of ums and ahs, that's why I'm trying to get through this video in one take. So we'll see. We'll see what happens. The first question that I am seeing here on Facebook comes from Kelly. And Kelly says that she had a L5S1 injury from sea doing in rough water, compression fracture, and then ended up with CRPS in her left foot within 2 months. She is unable to move her toes except for her big toe, and she's been doing physio, massage, and osteo therapies weekly. Her osteo massage therapist says that the L5S1 is swollen slash tight, and that is what's caused the CRPS. I have an MRI booked in a month for my spine, and any of your cases you've dealt with similar to this or have any advice, thanks. Yeah, Kelly, funny enough, your case sounds strikingly similar to mine. I had an injury in football that led to L5S1 surgery on a herniated disc. What I didn't know at the time is that herniated discs are poorly correlated with pain. And actually, um, believe it or not, physios, massage therapists, etc., are really bad at identifying specific locations or landmarks on the body. And actually, if you get 15 of the same massage therapists in the same room, or 15 of the same physical therapists in the same room, they will actually disagree on where certain landmarks fall in the body, or where certain areas that they're mobilizing are targeting treatment. And so I would be careful in listening to specific regions that someone is mentioning as tight or swollen. And I would also be careful I guess thinking that just because it's tight or swollen, that that's the cause of your CRPS. Many people will have tight or swollen muscles, joints, etc., and have no pain, let alone CRPS. I would also be a little bit, I guess, open-minded when it comes to getting an MRI. MRI is actually, research has shown that when you get an MRI, whether there's anything wrong or not, just seeing the image of your back can increase your pain because it makes things look very real and very scary, especially if we don't understand what the MRI is saying. A lot of MRIs will show quote unquote abnormal changes in the spine or the shoulder or the knee. And those changes will actually be fairly normal in the general population. On my website, under the research tab, I have a whole section talking about MRIs in individuals with no pain. And the MRIs will show herniated discs, bulging discs, degenerative discs, rotator cuff tears, meniscal tears, etc. And those are not indicative of pain. If your pain was being caused specifically by compression or injury to the an L5S1 nerve root, we would actually see a specific pattern of where your pain is, and you would have specific muscles that are weak because of that compression. And so, because CRPS isn't just pain and weakness, it's also other symptoms like redness, heat or cold feeling, hypersensitivity like allodynia or hyperalgesia. I would venture to guess that the cause of your CRPS is not the L5S1 injury. For me, same thing. I had two herniated discs or surgeries up to quote unquote repair a herniated discs. And then about 6 weeks later, after it was quote unquote repaired, I developed CRPS. But it was just in my left foot. If it was had anything to do with like my L5S1, I would feel it in various parts down my leg, and we know specifically what parts those are. And I'll put those on the screen now, so you can see exactly the areas that you would feel if we were talking about L5S1 specific compression. Okay. So yeah, I would caution you about getting too invested in the MRI or chasing structure too much. CRPS is a very complex thing, and there's a variety of elements that might contribute to it. There isn't one necessarily like root cause, if that makes sense. Um, okay. This next question is also from Kelly. She says, if you could touch on the topic of resetting your nervous system. You mentioned psilocybin in a previous video, and I did a pain management course about the use of psychedelics for pain management slash resetting nervous system by microdosing. My osteopath and massage therapist is also trying to reset my nervous system. Just wondering what your thoughts are slash practices are for this, since it seems to be the main component to overcoming CRPS. Yeah, Kelly, no, reprogramming or retraining your nervous system is a very important thing when it comes to CRPS. The term resetting implies that we can just like flip a switch or hit a button and it can change the nervous system. I wish it was that easy, but oftentimes our nervous system becomes hyperactive or hypersensitive because of a long period of hypervigilance from things such as anxiety, maybe traumatic events that we might have experienced. This could be traumatic medical events, traumatic injuries, traumatic life events, childhood events. And so there's a variety of things that contribute to amplifying or tilting our nervous system into fight or flight. The way to start to walk back and overcome certain aspects of CRPS is to take our nervous system out of fight or flight and put it into the other part of or aspect of our nervous system, which is rest and digest. These two nervous systems, fight or flight, rest and digest, aka sympathetic, parasympathetic, they are always in a balance and fluctuation with each other. That's why, like, when we're super stressed out in fight or flight, we have a hard time sleeping or digesting because that balance has shifted. And so, in order to reprogram or retrain our nervous system, we need to lean into things that calm us down. Okay. So, that could be things like deep breathing. It could be things like, for example, psilocybin, cannabis. It could be things like certain herbal teas that we enjoy. It could also be things like watching our favorite movie or spending time with friends, relaxing in our hammock, going out to take a look at our favorite hiking trail if we can't hike. Those kinds of things calm us down and reprogram, uh, retrain our nervous system to be more actively in a state of calm. Does that make sense? So it's not like we're going to reset our nervous system like with a flip of a switch, right? It's more so that we're creating practices and lifestyles that is calming down our stress levels and taking us out of fight or flight. Um, so that's another one. Okay, what else do we got here? Great questions, by the way, Kelly. Thank you so much. Gina, I need to find her first question. Okay, here we go. How do you get your body or mind out of fight or flight mode? I'm always anxious, and that doesn't help with the pain. So I addressed this a little bit in the last question, but I'll speak even more specifically to helping with anxiety. Anxiety is essentially um, having the mind and the brain having too many options and not really knowing where to go. Okay, so one of the things that I like to think about is like if you look towards your future and you see nothing or you see too much, too many things, that can be anxiety inducing because you don't know which direction to walk or where to move towards, and therefore you will generate anxiety because of that fear and worry about what is coming next. So the way that we start to get our body out of this fight or flight mode and reduce our anxiety is to start to, believe it or not, set some goals or create a direction or an aim. So that's why I have the document, like the better document or better exercise, which helps us visualize how we might feel or be in a year if we are getting better from CRPS. That's why I call it better. Okay. So think about what things you might want to do, Gina, a year from now when you're starting to feel a bit better. And then that gives you a destination, a goal, a single option to start to work towards. So, for example, I had another client this week talking about wanting to go back to hiking, and they said that they can't walk more than 5 minutes. I said, okay, that's your starting point. We're going to walk for 4 minutes. And then each day we're going to try to do 5 seconds more of walking or go 10 feet further. And then, so that gave them a clear goal, getting back to hiking, and it gave them a clear progression, starting walking in small doses. That alone will start to reduce the anxiety of the pain experience, and help calm things down. If you find yourself feeling anxious in certain situations, so for example, being in a place with a lot of crowded people, or maybe you have a fear of going on an elevator, take those situations, so a lot of people, and break it down and into manageable doses. So if you have this objective of going to the mall where there's a lot of people, maybe we go to the mall on a Monday morning when there's like nobody there. And that's your starting point. And then you end up going on a Tuesday afternoon and then a Thursday morning and then a Friday afternoon. See how you're slowly bringing things up to more and more manageable. You could also start with something like an outlet mall, because that's outdoors. There's more open space. You have abilities to manage the anxiousness in those situations, exit plans, etc. The more you expose yourself to the things that make you anxious in manageable doses, the less and less you feel anxious. So, for example, if you're afraid of an elevator, I'm not going to go put you on an elevator. What I would have you do is I would have you stand outside of, or sorry, look at a picture of a building that has an elevator inside of it, then look at a picture of an elevator, then go stand outside the building, then look into the building, then go look at the elevator, then go touch the buttons to the elevator, etc. You get the point. We're slowly progressing to walk towards these things that make us anxious. It's the same concept with pain. We are slowly working towards the things that make us anxious, and bring us pain to calm our nervous system, bring us out of fight or flight and into rest and digest in those situations or during that painful experience. Okay. And then you had another question here. To add to my question from before, is there a correlation between stress and anxiety and the chance of it spreading or happening when you injure yourself again? For example, I've had a couple injuries since I was diagnosed, and the last one, the big cut on my leg, I think it turned into something. The burning keeps increasing, especially with the cold weather. Thank you. So let's do an exercise that I think will be helpful to kind of answer this question. So everybody that's watching this video, what I'd like you to do right now in this moment is go ahead and close your eyes, and I want you to visualize a lemon on the table in front of you. I want you to imagine yourself taking a knife and cutting into that lemon, the juices squirting along the edges of the knife, and maybe even squirting out towards you and onto the cutting board. Then, once the knife is, or the lemon is cut in half, I want you to take one half of that lemon and just feel the texture of the outside of the lemon. Maybe it feels a bit rough or smooth in different areas. Your fingers running along the edge, just where you just cut that lemon. And then I want you to go ahead and bring that lemon up to your nose and mouth and smell it. The citrus aroma filling your nostrils. And after you've done that, I want you to imagine taking a bite into that lemon. Now, I have a question. Did you salivate? So, what that demonstrates, if you did salivate, is that just by imagining something happening, we can create a physiological change in our body. So by imagining biting into the lemon, we could taste the sourness and we got saliva in our mouth. Another way to do this is to think about eating hot wings, like spicy buffalo wings. A lot of times when I imagined going to eat those hot wings, I get salivation in my salivary glands. Literally imagining an action can create a change in your body. So with spread, sometimes imagining that it can happen or being worried about it happening is actually the catalyst for that happening. The cool part about that is, though, if you have some confidence that it's not going to happen or don't pay so much worry to it, it doesn't. So when it comes to myself and CRPS, I was told that it could come back with, any procedure that happens. And since CRPS, I have broken my collarbone, I have tattooed both my arms, I have tattooed my entire chest, including my nipples, and lasered all of it back off. And I have had no recurrence of CRPS pain. Um, so, that being said, is there a correlation between stress and anxiety and it spreading? Yes, because of the generalized worry related to that, but not in the sense that there's some sort of major change taking place that is creating CRPS, in that area. Um, and I'm going to go into detail on this in my next Zoom on January 4th, 2025 at 2 p.m. US Central Time. So please come into there and I can talk about spread a lot and remission, et cetera, a lot more. But yes, managing stress and anxiety will help us reduce the risk of experiencing something like pain showing up in other strange areas or after certain events or injuries, for sure. Okay, what else do we got here? So this is from Donna. Donna said, "How do I get rid of the depression and insomnia from CRPS? I'm usually very happy and active, and it's very frustrating. I'm not taking any pain meds, nor do I want to." Donna, I feel for you, and I'm very sorry that you're experiencing both difficulty sleeping and depression in relation to the CRPS. I want you to know that CRPS in and of itself is not causing this depression. So just by virtue of you having CRPS, like CRPS as a syndrome does not cause depression. And the reason I say that is because being in pain for a long time certainly can cause depression. But I don't want you to think that CRPS itself is the reason for depression. And the reason I say that is because by knowing that, you know that you can have an avenue to start to improve your overall mood and well-being, and that CRPS isn't restricting you from like a disease standpoint from helping you improve that mood. And so, what I would say to you is the best thing we can do, much as I mentioned to Gina in two questions back, is we can start to again visualize what would the future look like for Donna if she was doing better. What kind of things would Donna be doing that would bring her joy and happiness? And what of those things that she would like to do can she do right now to start to just bring a little bit of more light and sunshine to her every day? So maybe that's something like painting or giving, taking or making phone calls to your loved ones, spending time with your husband, whatever you can think of that will bring you even the smallest amount of joy each day and move you away from, I guess, feeling trapped in certain ways and towards feeling free, will start to help with that depression that you might be experiencing. If you have the ability to get in touch with a counselor or a psychologist, that would also be really helpful because they would have helpful tools for you to again start moving out of that feeling of depression. From the insomnia standpoint, I have a sleep toolkit that I just sent out on my mailing list. I believe you're on it, so I believe you got that toolkit. Use some of those items on there on that 10-item list to try and improve your sleep a little bit. Some of the things that are on there that you can do are things like creating a sleep ritual. So a lot of my patients and clients, they will get specific clothing that is comfortable and signifies to their mind it is time to sleep. They will also set the temperature in their room to below 70 degrees because in order to fall and stay asleep, our body temperature needs to reduce by about 2 to 3 degrees. And that having a colder room or darker environment helps with that. There's plenty of other things on that list that I sent out. If you didn't get it, reach out to me and I'll send it to you. And if you're watching this video and you aren't on my mailing list, you can go to thewindowpain.com, PAIN, and join the mailing list. It's the first link at the top of the page you'll see there. You can join it and you'll get handouts that I send out like that for free. All right, let's see. Who else do we got here? Deborah Reynolds said, "Why does CRPS cause a burning sensation? The side of my knee is very tender. It always feels like my flares start at this location." So CRPS is interesting. CRPS is a malfunction of our nervous system, which is our alarm system, our body's alarm system. So I want you to think about just any alarm system in general. So let's take a house, for example. I've mentioned this before, but I want to mention it here too. If you hear about some break-ins in the neighborhood at your house, right? And you start to hear on the news and from your neighbors, there's been some break-ins to homes. What are you going to do? Well, you're going to upgrade your security system or install one if you don't have one. You might add at first, some motion sensors and maybe some door alarms, just the alarms on the door that are connected like this, and when it opens, it beeps. That might be your first step. Then you hear about further break-ins closer to your house. Maybe your next door neighbor gets broken into. Then we're going to need to upgrade the alarm system again because we're getting increasingly nervous. So we're going to add some more cameras, maybe some floodlights, etc. Then the next day, you start to notice someone walking, a shadowy figure walking outside of the house, and the nervousness amplifies even more. So we add maybe a guard dog, maybe some ground sensors in the house. Maybe we add a moat. We start to upgrade and upgrade and upgrade the alarm system. And then worst case scenario, we're at home and someone breaks the back window. Then our alarm system is getting super duper enhanced, right? And so if you're in Texas, you already have this, but if you're anywhere else, you're gonna maybe you're getting a gun for security. Maybe you're having police circle the house, just to be safe. And then the alarm system eventually becomes so enhanced and so intense that even just getting out of bed and touching the ground with your foot sets off the whole house. The whole house is screaming, intruder alert, intruder alert. Okay, that alarm system is going to stay installed and stay intense until the threat of whoever is breaking into these houses is neutralized or reduced. So you will keep the moat, the guns, the guard dog, everything until that threat that you've been hearing about starts to dissipate. So maybe someone gets arrested for burglaring and they're blamed for all of the burglaries that happened. Maybe you start to notice that your neighbors are taking down some of their equipment. Maybe you see that the cops' presence in the neighborhood isn't as high, and so you feel a little bit safer. Then you start to fill in the moat. You start to put the guns in the gun safe or sell them. You turn the guard dog into just your pet dog. And eventually the alarm system functions as a normal, as just a general alarm, period. CRPS is kind of the same way as that super intense, super upgraded alarm system. So what has happened with our nervous system is we've had a break-in or haven't, but in some cases we've had a break-in, which is an initial injury. And then After the initial injury, when our pain was still high, or even if we didn't have an injury, when our nervous system for some reason got amped up, right, and extra sensitive like that super intense alarm, we started to hear information from doctors that scared us in the same way that being a burglar outside of the house is scary, or hearing about that burglar. And our alarm system continued to upgrade. Okay, so we heard things like, you'll never get better. We heard things like, this is the most painful condition you could ever experience, which it is. I've experienced it, right? We've experienced pain over and over and over again, which are subsequent break-ins to our nervous system, as time has gone on. We have had medical procedures that didn't help us. We've taken medications that didn't help us, and we've seen a bunch of specialists that told us a bunch of different things. And so what has happened is we've had that person walking outside the window in the form of scary medical things we've been told. We've also had that break-in into the back window of the house in the form of spinal cord stimulators or nerve ablations, etc. And so what has happened is we've continually upgraded our nervous system, aka the body's alarm system. It's called a nervous system for a reason. Um, and now we need to start to downgrade it. The thing is, when the nervous system is super upgraded, it starts to do a lot of weird stuff. Okay, so it might have a burning sensation. You might have a freezing sensation. You might have swelling. You might not. You might have redness, purpleness, silverness, shininess. You might not. The alarm system is just going haywire. Imagine, for example, the house alarm just freaking out, electrical things getting crossed, and now the lights in front of the house are flashing. The shutters, for some reason, are flapping open and shut. The water's turning on and off. The alarm system has malfunctioned, and now we need to repair and fix it. So the way that we start to repair things, the way that we start to improve our burning sensation, the way that we start to improve the tenderness is to start to prove to our brain and our nervous system that we are safe, to start to show them that we don't need the cops around so often, like the inflammatory cells. We don't need all these cameras looking at and paying attention to all these symptoms. What we need instead is to show the nervous system and the body's alarm system that things are okay. The way that we show the nervous system and alarm and body's alarm system that things are okay is by providing it with information in small doses that don't set off the alarm system. So, if the side of your knee is very tender and your flares start at that point, what I would like you to do is very gently begin touching that area or close to that area, or maybe even just the opposite knee, to start to give the brain information so that it can update the nervous system with a message of, this is safe. It is okay to touch this. I don't need the alarm right now. And you can even, while you touch it, say things like, I am safe. I'm just touching my knee. This shouldn't hurt. I am okay. I'm safe. This is gentle. You can touch it with a hand, with a cotton ball, with a stuffed animal, with a blanket, with something super soft to start, and then start upgrading things to things that are a little bit less soft or a little bit more irritating, but do it very, very, very slowly. And that way, the brain has time to update and downgrade the alarm system, pull away the cameras, fill in the moat, put away the guns, and then gradually over time, those weird sensations and weird symptoms will dissipate. And I believe this will answer a lot of different questions that people have had this week. But let's move on to the next one. Okay, so Amy Thompson said, can true permanent nerve injury be healed through pain reprocessing? I know nerves have the ability to heal at a very slow rate. Is there such thing as permanence? So, I was excited for this question because this is something that I struggled with myself because I had technically or theoretically nerve damage from my L5S1 surgery, which is what quote unquote caused CRPS. Yes, all injuries will heal. and nerves do heal. Now, they heal in a variety of ways. So I want you to think about this. I want you to picture someone. For example, I have a friend of mine who has an amputated leg, not from CRPS, from an injury that she had when she was younger. Her nerves are damaged forever because the nerves are literally cut off because her leg is gone. Okay, but she does not have pain in her leg. Did she initially have phantom limb pain because the nerves were gone? Yes. But now she does not have pain, even though the nerves are still damaged. They've been cut off, gone. Um, so even if there is permanent nerve damage, you can uh, reprocess the way those nerves are experiencing sensation through things like desensitization. That is why, when it comes to phantom limb pain, mirror therapy is effective. That is also the reason why with CRPS, mirror therapy is sometimes effective. It is also why we do things like desensitization for phantom limb pain on the amputee stump. So let's say my arm is missing right here because the nerves were all cut here and my arm is gone. This is all going to be extremely sensitive. And if I never touch it, it will never get used to that sensitivity. And so, with people who are amputees, one of the things that we do to reprogram the nerves, reprocess the pain or the signals being sent to the nerves, is we start to touch it. And sometimes we start as small as a cotton ball or a Kleenex or a blanket or a stuffed animal. And so these concepts are very similar, both for CRPS and for phantom limb pain. And in that instance, the nerves are literally damaged forever, but you can change the way the nerves process pain just by doing some of these desensitization techniques. So the reason I was excited for this question is because I want you to, I guess, let go of the worry that if your nerve is permanently damaged, that it can't learn to process pain in a tolerable way again. The body is extremely remarkable, and it is capable of doing those things by virtue of the fact that only 20% of amputees have phantom limb pain, and the others do okay. So I want you to know that, and I hope that is helpful just by seeing that. Okay. Amy, again, two more questions, and these are great. Why does going into a noisy environment affect pain level? So I want you to imagine that your nervous system is in fight or flight mode, because it is when we're in CRPS or when we're in chronic pain. If our nervous system is in fight or flight mode, it is the same as if we were getting chased by a lion. So if we're getting chased by a lion, a lot of things happen. So this first and foremost, we breathe like this, right? Really fast, really heavy. The next thing that happens is all of our blood flow goes to our muscles and our extremities. And because we have to run, we have to be ready to fight at any time, getting away from the lion. Another thing that happens is our vision gets more tunneled, more attuned to what is in front of us because we don't need to pay attention as much to the periphery. We need to just focus on getting away. The next thing that happens is our hearing becomes more aware because if another lion shows up and a twig breaks over there on the right side of us, we need to be able to hear that twig breaking. And so, with all of these enhancements to help us get away from a threat in this fight or flight nervous system situation, if we are constantly in this fight or flight situation and we never come down from it, then of course going into a noisy environment where when we have just enhanced hearing to hear the twig that the lion's about to break, of course, going into a noisy environment is going to set off that pain alarm system that I've talked about. When the pain alarm system gets set off by that intense noise, then we're going to have more pain. Okay. This is the same thing for things like weather changes. When the weather starts to get more cold, our body is so amped up that the alarm notices the change in the weather and the change in the cold, and then we feel more pain. That same thing it has to do with pressure. And then when the next question that you had, Amy, why does my affected limb get cold at random times when I least expect it? Same thing. The alarm system is freaking out. And so it'll do some strange and weird things. The best thing we can do is notice, yes, it's happening, but try our best to not pay it too much attention and continue to move forward with our activities and our goals that we can tolerate. Because the more information that we give that limb, the better it's going to be for helping the nervous system reprocess and learn that things are safe again, to tone down the alarm. Okay. Lenora said, this is more a comment than a question, but just from my own experience, women need to be aware that the stress of chronic pain can mess with the reproductive hormones. When our body is under stress, the body will protect it with higher estrogen, and then that can lead to issues with fertility. I've had to deal with this over the years, and it's good to help women be aware of it. Lenora's right. When we are in high levels of stress, whether that is emotional stress or activity stress, it will mess with things like reproduction, or even, for example, in women who are like very high level runners or athletes. A lot of those women, because of the this physical stress of athletics, might stop having their period for a period of time that they are competing in marathons or sprinting or the Olympics, etc. It's the same kind of thing. The body doesn't really know the difference between physical stress and mental and emotional stress. And so the body makes adjustments based on those stresses. So stress reduction in all kinds of ways is a very helpful thing for CRPS, of course. Great comment, Lenora. Okay, let's see. Who else do we got? Sherry. So Sherry is asking, what type of doctor should my son be seeing? We were told to go to the pain doctor who ended up refusing any other help when my son turned down gabapentin. We haven't been to anyone else because it seemed like that was the only option. He did go to PT, but even they seemed to not really know what it was. And with my son's mental disability, getting him to do the work was a battle. It feels like we are all left in limbo. I see people post about OHSU, and getting him there is going to be difficult for me because of other circumstances. We are in Salem, Oregon, and seem to be super limited on doctors. Can't even find anyone that's a TPS. The whole situation for him feels hopeless. Man, Sherry, I'm sorry. That's got to be really hard to deal with, especially when people who are supposed to be helping you aren't able to offer you information. Unfortunately, that was the case for me 10 years ago, and that's still kind of the case now for a lot of people, especially in uh, certain cities, etc. If you are looking for advice and help, you can reach out to me from a pain coaching standpoint, or continue, of course, using these free resources. But I would say the best providers for your son to see would be a team that includes a regular physician like a PCP, or a pain doctor, which you tried, a physical therapist who has familiarity with CRPS, and then a counselor or a behavioral type of psychologist. Depending on your son's mental disability, that might be the most helpful thing for you to find and search for. So searching for like a pain psychologist, or even just any general psychologist, to help your son move towards getting back to activity again. But yeah, I'd have to know more about your son's disability and also just his age in general. I've had many patients that have had Down syndrome or autism, etc. And approaching pain and painful things and getting them to feel comfortable with experiencing some discomfort is a challenge for sure. But it's something I'm familiar with and have done often. So if you need pointers, reach out to me on Facebook and messages, or via email, etc., and I'll be happy to provide you some information. Okay, let's see. Sheila, my foot has been unable to move since I fractured it 10 weeks ago. My foot started getting the CRPS coloring around 2 weeks after I heard it. I've been unable to bend my toes and the front part of my foot. The nerves are super sensitive in my toes. Imaging has shown that I have developed disuse osteopenia due to not being able to walk for 10 weeks. My PT wants my foot to get moving and is quite aggressive with moving my toes around, or at least it feels that way. It probably really isn't, but it feels aggressive, like she's ripping my toes off. But she says I need to get them moving. Is this going to make the pain last longer by causing more pain, or is it good for it? She's treated a few CRPS patients in the past and they have improved. Second question. The place I fractured it still feels like it fractured. Is this due to CRPS? This is the first time I fractured something, so I'm wondering if it will always feel this way. I'm afraid to refracture it. Third question is, the more I move my foot, the colder it gets. Why is that? I had better questions this morning when I woke up, and I should have wrote them down. Thanks so much. If you think of more, Sheila, put them in for next week, and I'll answer them. So yeah, let me summarize this a little bit. So fractured her foot 10 weeks ago. It's still in the process of healing, but after 10 weeks, it's the bone itself is actually really healing very well. One of the biggest things and best things we can do for a fracture is putting weight through it. This is because of a concept called Wolff's Law, which I've mentioned before. Bones will remodel and reform based on the forces we put on them. So that's why starting to weight bear and put pressure is good for building bone. That's also why, unfortunately, you're having this imaging that is showing osteopenia due to you not being able to walk for 10 weeks. The cool thing is we can reverse that and change that by starting to put forces through the foot. I know that's going to be hard because your foot feels really sensitive right now, but start super small. Start with just putting the foot against the end of the couch or on a chair. Start with, and then start in a seated position and leaning onto the foot a few times back and forth, maybe twice per day, depending on your pain level, or 20 times per day, if that's not too intolerable. Yes, you do want to push into some discomfort. No, it won't make the pain necessarily last longer, but within reason. Okay. So you don't want to be like destroying yourself trying to move things or put weight through things. But you do want to poke into the pain bear just a little bit. I call it poking into the bear, but not waking it up. And that is how you give the foot information and help the overactive alarm system, which is CRPS, calm itself back down. With this fracture, so it feeling like it's still fractured. Yeah, it does, and it is due to the CRPS in the sense that the alarm system is extra active, and of course the site of injury is going to feel the most sensitive. But as things get better, that expansion around the site of injury. So let's say this is your foot, right? Let's say right now, the CRPS aspect of things, I do have shorts on. Sorry, it looks like I have no pants on. The CRPS aspect of things is causing pain all through here, right? As things start to get better, that pain is going to kind of come towards the middle and back towards, maybe you fractured it here. It's going to center here and you'll feel only the pain here. And then as things start to get better and you start to heal and put weight through the foot again, eventually this pain will go away. Or it'll be at a level that is tolerable enough that you can just go about your daily life. And then one day you might notice it's gone. So in summary, yes, it is good for it to keep moving. Communicate with a physical therapist. If you need to pace yourself just a little bit more, then let her know. She has experience with CRPS, so she should hopefully be okay with pacing things a little bit. But if she's helped other people with CRPS, you can have confidence that she could probably help you as well. So yeah, if you have any more questions, just let me know. Um, oh, let me finish with this one. Um, no, it won't always feel that way. It will not always feel like you fractured it. Um, Please try not to be afraid to refracture it. Oftentimes, after a fracture, bone grows back stronger because there's a scar tissue element to it. So, like, I fractured my collarbone, and I feel like it's stronger than my other collarbone now, because of the scar tissue that has developed in it. And then, lastly, the more I move the foot, the colder it gets. Why is that? Again, the alarm is weird. It malfunctions. It's acting silly. The best thing we can do is not pay so much attention to it, and continue forward. continue starting to put weight on it, continue trying to bend the toes. Some things you can do if you want to practice bending the toes, practice bending it yourself. Put your feet on the ground on top of a towel and try to scrunch the towel up with your toes. You won't be able to because I can't even do it normally. But just that trying to make that effort of bending the toes to scrunch the towel is going to be helpful, and it's going to work all the muscles inside your foot there. Okay. Okay. Caroline, I was diagnosed with CRPS after a knee surgery I had. I saw a neurologist a few months ago, and he said I had CRPS and developed functional neurologic disorder because of the pain from the CRPS. Is this common with CRPS patients? So FND and CRPS do co-present sometimes. I would say it's more common for FND to present with CRPS, if that makes sense. FND, functional neurologic symptom disorder, is a condition where intense emotions are processed and felt by the body. So we could have a situation where we are passing out, having a pseudo seizures, having abnormal movements like moving our arms strangely, but it is not because there's anything necessarily wrong with our nervous system, like our brain and our spinal cord, theoretically. It is because of the emotions that we are unable to process. So if we have CRPS and we are experiencing a lot of stress, anxiety, anger, frustration, etc., and we're not letting that emotion out and we're just absorbing it, then I could see it possible that FND could present from that. But the plan is still the same as with CRPS and FND. So when I get a patient who has FND and CRPS, the plan is still the same. I still approach it the same way. This is the body's alarm system overreacting to certain stimulus and including emotional stimulus. And we need to calm the alarm system down as much as possible. So I teach people with this condition how to feel and notice emotions. I have them keep something like an emotion journal when their pain is high or when they are having more FND episodes. I have them record what emotions they might have been feeling, and then we talk about that together while we exercise. This is great for people with CRPS as well. When your pain is super high, I would encourage you to write down, what am I feeling with this pain? Am I angry because I'm in pain? Am I angry at my in-laws? Am I angry at my husband? Start to notice like what kind of emotions are contributed in this pain, and you'd be surprised what kind of stuff you find. And the more that you look at your emotions and you observe them from afar, the less you feel and manifest those emotions in your body. The way I like to think about this is like anger, for example. If you are feeling angry, you feel tightness in your jaw, you might clench your fists or scrunch your shoulders up, like this. That's very different from observing anger. Does that make sense? So if I'm feeling angry, I feel that way. But if I'm at the airport and I see a husband and a wife fighting about the fact that the flight is delayed and her mom is going to be so mad and the kids are crying, I am observing anger. And it's very different. My body is not feeling tensed up and my jaw is not clenching. I'm just watching them arguing and yelling at each other. And it's a very different experience. And so by charting and keeping track of our emotions, we actually get better at being an observer of our emotions rather than an experiencer. Then emotions feel less scary and we just notice when they come up. Just by doing that, believe it or not, we can reduce our pain from CRPS, and we can reduce the symptoms we might feel through FND. Okay. Allison, you mentioned to strive for even 1% improvement. Does that apply to range of motion as well? I'm 14 weeks post-surgery, tendon transfer, and while I continue to make progress, it's very slow. My pain management doc is concerned about contracture. Does there come a point where slow progress isn't good enough? So I actually already answered this on Facebook, but progress is progress. Um, uh, Progress in any form is always good enough, especially if we're operating with a super sensitive alarm system. So do as much as you can within the limits of your pain and occasionally push a bit further when you are feeling up to it. That is going to, again, 1% improvement per day is 37 times better at the end of a year. 1% is huge. It's absolutely huge. So, yes, 1% is enough. You do what you can regardless, and you move forward from there. If you experience something like a contracture, something that you can do with your doctors is talk about something like Botox to calm down that tightened or contracted muscle. That there is benefit to that in relaxing the muscle for a period of time, so you can get the motion back if that happens. But if that hasn't happened yet, then you don't have to worry about that Botox aspect. But that is a possibility or an option, and I do have patients that benefit from something like that occasionally. Okay. So Robbie said, I am in this group because my 11-year-old son was diagnosed with CRPS in his right groin. I feel like there are so many different directions a person can take and overwhelmed about doing the right thing for my son. We have done scrambler therapy with some relief. His anxiety causes pain to increase. I'm constantly finding ways to reduce his anxiety. He quit walking for a few months ago with but with swim therapy and PT, he is now walking again, but still has pain. Now walking again, I love it. Uh, Dr. Maxwell did tell me to give extra calcium, vitamin D, K2, magnesium, but I'm unsure of how much is recommended. I guess one question would be how much of these supplements should I be giving him? Should we still be doing PT? We were dismissed because his goal, which was walking, was met. We were told we needed another goal or insurance will not pay. Any advice or direction is greatly appreciated. Man, that's there's like two things happening there. I'm very happy, and I'm also very frustrated. So I'm very happy that you have had success, some relief with scrambler therapy. I'm very happy that you've noticed the correlation between anxiety and pain, which I've talked about a few times during this Q&A session. I'm very happy that he got back to walking through swim therapy and PT. But I'm also very frustrated when it comes to uh, the PT saying that he needed a different goal besides walking. With something like CRPS, the problem isn't necessarily like certain functional goals like walking. The problem is the pain. And so you write goals based on pain to get approval from insurance for PT. So, for example, when I write goals, I say the patient will be able to tolerate a 30-minute PT session 3 times per week and with minimal to no reports of pain. And then I write goals like that and I send it to insurance. The patient will be able to verbalize 3 pain management techniques back to the therapist to demonstrate the ability to independently manage his pain. So you write the goals to show that pain improvement and improving function around pain is the goal, and then the insurance approves it. Now, I don't know what state you're in. It might be different in other states. I personally am really blessed because I work for a very large hospital, and when I am writing insurance things, they know I am a complex pain therapist, and approval is a lot easier. I'm used to dealing with CRPS. That is my main wheelhouse. So it's different for me. Um, as far as supplements go, don't worry too much about the dosages. Um, I don't know specifics when it comes to kids, but finding relaxing teas that have some of these supplements that he could drink, or sports drinks that have some of these ingredients in them that might be good. Those kinds of things, and saying to him, "Hey, my son, this is going to help you. This is like your power up." Like maybe he plays video games. You frame it to him as like this is your chug jug from Fortnite. That's going to help you be able to tolerate walking and doing things. You can use that kind of messaging to help give him, the 11-year-old, motivation. I do this with my patients all the time. A lot of my patients like anime, so I'll use terms from anime to get them excited, etc. Both with my patients and my pain coaching clients. So yeah, if you want further advice or direction, feel free to reach out to me in regards to pain coaching, especially if you've gotten let go from PT. And let's talk about some things we can do for your son. That's my my bread and butter. So I'd be happy to work with you and discuss further. But otherwise, keep him active. Do what he can when he can, and I think he'll be just fine. So we can talk about it further in a pain consult if you'd like to. Let's see. What else do we gotta? Sorry, guys, I gotta go through and make sure I've hit everything. I think that's everything for this week. I've talked about a lot. If you have questions or comments or want further clarification, please put that down in the comments below underneath this Q&A, and I'll do my best to continue to explain CRPS in the best way that I can and in ways that kind of eliminate the fear of this condition and give you guys tangible things that can help you improve your pain. Things that I did for myself and things that I have learned over the last 10 years of my working in my profession and my education and learning and understanding pain and pain science as a whole. I hope this has been helpful. I'm really looking forward to next Friday when we do the next Q&A. Yeah, next time I make the post, be sure to ask questions or comment with questions down below. Again, if you're looking for further guidance and want to look into one-on-one pain coaching, you can visit my website. Also, you can visit my website to get notified when the self-guided 8-week program comes out in February. There'll be a few options for that, and it will be very affordable and HSA eligible. So I'm really happy to announce that. So yeah, stay tuned, and I'll see you guys next Friday, and then for the next Q&A, and then also next Saturday, January 4th, 2 p.m. US Central Time will be our next Zoom, where we will cover remission, spreading, and stages when it comes to CRPS. So excited for that. Thanks, guys. Have a good weekend. Take care. Bye bye.